Ministry of Health has allayed fears of Ugandans about misinformation that is derailing the COVID-19 fight. The ministry has indeed started educating the public about issues like the vaccine, which despite not being 100% efficient, is a remedy especially after the 2 doses.
COVID-19 vaccines take about 2 weeks to be effective in a person. This means anyone who got infected maybe 1 week before vaccination is not protected and he can still develop COVID disease because the body is not ready. The body has not generated the immune response to protect him. The same is also true if you get vaccinated today and you get infected maybe tomorrow. Your body cannot contain that infection the same way someone who has been vaccinated long ago, because the body is not prepared to deal with this new infection. Number 2, COVID-19 vaccine, especially AstraZeneca, gives you better protection when there are 2 doses. So when you give the first dose, it gives you about 50% protection. So what it means is that 1 dose cannot protect you fully. So because you are not fully protected, you can still get infected, you can still progress to severe disease, you can still die. So the observation that people who have been vaccinated have developed severe disease and death is not enough to say the vaccines do not have impact. They do.
The other area that has perturbed the public is the testing versus vaccination issue.
And our position, and indeed the global guidance for COVID-19 vaccination is testing is not a prerequisite. Testing is not required. So please, let's put this across to our public. We should stop creating unnecessary anxiety. Let's get information from accredited sources.
Why then do most vaccinated people present similar reactions as COVID-19 patients?
COVID-19 signs and symptoms, some of them resemble the one of the vaccines, right? So if you're already having signs and symptoms, you can go and test, but it is not a precondition. We just want to be sure that you do not confuse the signs and symptoms of COVID, which you have already got, with the signs and symptoms of the side effects which follow, the events which follow vaccination. So if you have no symptoms, you are going to present yourself. You'll be vaccinated. So what has killed you is not the vaccine. What has killed you is the fact that you were already infected, and infected at a time when the body has not generated the protection or the ability to fight the COVID-19 disease, because it requires 14 days.
The ministry has assured Ugandans that despite the lockdown, vaccination will continue through outreaches at more centers to avoid further spread. John Barnes, Sentamo, reporting.